An Oxfam report says the South African healthcare system hangs on the edge of a precipice. It says a combination of profit-seeking private healthcare entities, underinvestment from government, has driven unfair practices in the South African healthcare sector. The study cites poor treatment of healthcare workers, which it says has compromised the quality of healthcare, resulting in a healthcare system ill-prepared for shocks such as COVID-19. Dr Basani Baloyi, Inequality Programme Manager at Oxfam SA, joins us now. Very good evening to you, Dr Baloyi, and thank you so much for speaking to us. How has COVID-19 as a pandemic brought into sharp focus these inequalities and fragilities that we talk about in the healthcare system?
Well, I think it has brought it into sharper focus. The fact that we have a health system that basically is critically under-resourced, where many healthcare workers do not have enough, PPEs and the like, or there's just a chronic shortage or it's not a chronic shortage, but rather a chronic understaffing of healthcare workers to actually respond to this crisis. And much of that is based on one of the triple threats that you've highlighted, and that is an austerity budget that has been consistently practiced within this country over the last few years, and clearly, given last year's budget, will continue to do so, which has resulted in a chronic, and what one of the nurses mentioned at today's launch, a severe and chronic understaffing of healthcare workers, and where various strategies have been taken to create the situation of cost containment, such as hiring bans on healthcare workers, particularly nurses, and also the de-skilling of their profession, resulting in a healthcare workforce that is overly stretched for the kinds of demands that it has to take care of, right? Where we have one of the worst health outcomes. However, the kinds of the resourcing that we have does not meet the needs and demands of the healthcare system. So indeed, that is just one area, and that is the area of the budget. And another area that we were looking at is, as you mentioned, the profit-seeking or a very extractive private healthcare sector, where we note that shareholders between 2016 and 2019 were paid a bonanza of 19 billion rand, while profits that were made were 11 billion rand. Therefore, they are being paid out more than the profits that were made. One of the companies, in fact, paid shareholders a 1.3 billion bonanza instead of reinvesting that money into the company. At the same time, had made losses of about 400 million rand. And this has happened at the same time as we have seen a lot of job insecurity within the private healthcare sector, which currently is the dominant employer or client to labor brokers workers.
Dr. Baloyi, allow me to jump in and talk about the funding issue and resources lack thereof. You have mentioned in the report that this is in fact in contravention of the United Nations Committee on Economic, Social and Cultural Rights, human rights commitment. How so?
Definitely. I mean, the international law statute that you point out protects the right to healthcare, universal healthcare, and it demands that the state needs to make resources available to universal public goods, and healthcare being one, education being another. And we are in contravention of that statute, right? So, and there are a number of other contraventions that we are in, and deeply, I mean, what we're finding is that this is very problematic because, again, it compromises our healthcare system, and we're having a government that is really not accountable to the very statutes that it's actually signing up to, and the right to health being one, which is also enshrined within our Constitution.
So I just want to make the connection, and I know you did, but just a little bit more explicitly, between not only the right to health care or dignified healthcare conditions, but also the right to a living wage. Talk to us also about policies that are in place, especially those that protect women in situations of abuse of one form or the other. How does that connect with quality healthcare so that the end user actually understands the impact?
That is such a critical question that you're asking. One of the nurses that we had today was saying to us that I feel like I have to split myself into 1,000 pieces. I, on a daily basis, have to face multiple dilemmas where I have to decide who has the right to life and who cannot have that right to life. Because quite simply, quite frankly, there are not many of me around to actually meet the needs of the system. And why has that happened is because of the way in which the budget has been set up to actually understaff the healthcare system. Critically, as part of that, is that there are particular gaps within our labor law that make care workers, healthcare workers, particularly vulnerable to having extended hours of work, where they work more hours, within a context of understaffing and also budget cuts where you're actually cutting administrative workers who are the support system of the healthcare system. Then you're facing healthcare workers that are actually also having to take up the jobs of administrative and also being security guards, also being cleaners, and doing a range of tasks, therefore neglecting the care work responsibilities that they have, right? And so what you then face is a tension between the patient and the healthcare worker. And on top of that, there have been freezes in the wages, and many healthcare workers having to take up, including critically community healthcare workers that are paid a pittance of a stipend, are having to take up multiple jobs just to make ends meet, suffering from debt, right? And therefore, given that kind of tension, are simply exhausted when they're having to do their patient work.
Dr.
So
Basani
what we are
Baloyi
experiencing is not the best. Sorry. Yes?
No, you can complete your train of thought. It's fine.
No, all I was saying is that we have an overly stretched healthcare workforce, very vulnerable, very insecure, having to find multiple income strategies, and therefore unable to do the care work that it's meant to do, and it compromises the care work, which is why we are making the link between ensuring dignified healthcare work in order to, as a critical way of ensuring a right to healthcare for all of us of society. For me to have, and for you to have good healthcare, we need to ensure, and this works both in the public and the private healthcare sector, because there's a lot of misdemeanors that are happening there in terms of working conditions. So we are saying that in taking care of them, we actually take care of us. That's why we have to care for the carers.
And I think COVID-19 has deeply underscored just how important healthcare workers are and how essential they are to our well-being and livelihoods. Thank you very much. Dr. Basani Baloyi is Inequality Programme Manager at Oxfam SA. And I'm sure many healthcare workers who are watching this nodding their heads. That's why some of them are saying that they are going on strike, that they're not going to attend to patients unless they have the necessary PPEs. These are just some of the stories that are developing around the country in line with this.